Exercise and physical activity are linked to good health in almost any way that it is possible to measure or discuss. For over a generation, Americans have been buying exercise equipment, exercise clothing, reading books, and joining gyms. At the same time, we continue to get less and less active, and the rates of obesity, diabetes, and heart disease continue to increase. You may be listening to this presentation on your iPod while working out, but chances are you're sitting in front of your computer. Whereas in the past, most of us were laborers, either in the field, the factory, or the shop. Today, most of us are significantly less active than our parents and grandparents. There is strong evidence that regular exercise is an important health habit. We know that an inactive lifestyle is associated with higher rates of high blood pressure, cholesterol, diabetes, obesity, and heart disease. And people who don't participate in regular exercise have a 50% chance of developing heart disease and a 30 to 50% chance of having high blood pressure compared to people who exercise on a regular basis. In fact, the most common risk factor for heart disease is physical inactivity. Only 22% of the U.S. population exercises on a regular basis. Well, why is exercise so beneficial? Well, remember, your heart is a muscle, a pump, and a battery. Like any muscle, if you exercise it, it'll get stronger. A stronger heart muscle can do more work with less effort. If you were to have a heart attack, a stronger heart can compensate for the damaged area, making it more likely for you to survive. By reducing risk factors, you are making it easier for your heart to do its pumping job. Finally, exercise will help the heart recharge its battery. Therefore, exercise will increase the ability of the heart to pump and deliver oxygen. It'll improve your cholesterol, stress, body fat, blood pressure, and blood sugar. It'll give you more energy, help you sleep better, and improve the health of your bones. And it will positively, absolutely prevent, stabilize, and reverse your risk of coronary artery disease. Low aerobic fitness is an independent risk factor for all-cause mortality. Higher fitness levels result in lower death rates from heart disease and cancer, and the greatest reduction occurs as you progress from lowest levels of fitness to the very next level. But how do we know that you're getting enough exercise and that you're getting the most out of your efforts? Well, the best way to measure your fitness is with a graded exercise test, the results of which can be measured in METs, which is your workload, or VO2, which is the amount of oxygen that you consume. If this is done in your doctor's office, your risk of heart disease can be determined by your electrocardiogram, your heart rate and blood pressure response to exercise, and whether or not you experience any symptoms, such as chest pain. More on this in the checking section. We can also base your exercise prescription on the results of your stress test, and you will get a target heart rate. Your fitness can also be measured from a 6-minute walk test, and this is a good test for heart failure and pulmonary patients. Finally, we can also measure your physical activity. The easiest way is with a pedometer. Your goal should be between 6,000 and 10,000 steps per day. Remember that this may require some trial and error. If you do not have a pedometer, we can also add the total number of minutes of physical activity per week. Our goal is at least 150 minutes.